First of all, I would like to thank the organizer for inviting me to the webinar and cordially greet the panelists and participants. Energy population presents a major challenge for the world. According to forecast, in 2035, Spain will have 26.5% of its population over the age of 65. At the same time, life expectancy increased from decade to decade and currently stands at an average of 83.5 years. This data reflects the magnitude of this challenge, which directly affects practically all social aspects from the medical field to the economy. The first economic impact of an aging population is the sustainability of the pension system. Secondly, the situation affects the healthcare system. Most experts advocate modifying the system and preparing it to treat chronic ailment while offering continuous care, since a third of people over 65 in Spain are dependent. This situation also presents opportunity, such as the so-called silver economy, dedicated especially to the elderly, which currently represent 25% of the gross domestic produce of the European Union. In the city of Malaga, within the scope of our power, we have been working on these issues for some time by supporting healthy aging with action in the areas of digital equality, affordable housing, quality of life, physical and mental well-being, and leisure. For example, the Municipal Social Rights Department consults information and advice to develop prevention service aimed at the elderly through the management of programs to promote active aging, cognitive health, support for the associative community, and promotion of personal autonomy. The plan for the promotion of active aging is part of the 7th Social Inclusion Plan of the Malaga City Council, 2021 to 2024. It integrates multiple aspects that affect any city and promote the active participation of older people during the process. The lines of action of this new plan focus on promoting the associative movement, facilitating leisure activities, and maintaining the development of initiatives that promote cognitive health. This plan contemplates leisure activity at the Carnival, the Fair and Holy Week, with the participation of associations for the elderly, and is articulated through the Sectorial Council for the Elderly. The prevention of dependency with development of activities in social centers and workshops for the elderly. The promotion of cognitive health through the Center for Healthy Aging. The local mobilization of resources against the loneliness and isolation of the elderly through the promotion of their autonomy. Our teams provide the elderly with information, advice, resources, and services on prevention designed for them. There is a service center for the Association of Older People, which seeks to promote the participation of older people while supporting the community through participation bodies. The Healthy Aging Center facility is for older people and associations whose objective is to promote a healthy lifestyle among them. They are currently developing the Successful Aging Memory Program, offering training in dependency prevention and providing education on new topics. In 2013, the center incorporated the classroom grader, a space equipped with 6 computers that contain training programs for the recovery of higher cognitive functions in people diagnosed with dementia. Before the 2020 confinement, activities were carried out in all municipal districts and coordinated by the Center for Healthy Aging. Given the situation in 2020, the Cognitive Health Promotion Program was launched through the Healthy Aging Center as it was considered necessary to maintain the memory and cognitive stimulation project. A contingency plan was developed, including online memory training workshop and cognitive stimulation workshops. Since then, gradually, those face-to-face activities that promote the recovery of the group's social participation have been resumed. Municipal psychologists and geriatricians are responsible for the memory and cognitive stimulation workshops directed to people over 60 years of age. Since the beginning of the initiative, more than 10,000 older citizens have been participated in this 3-month workshop carried out in all the district. Another program to highlight was developed in collaboration with the Red Cross, the Arena Foundation, and the Telephone of Hope. This program reduced the social isolation of the city's elderly with the participation of more than 4,500 older people. Through the Municipal Observatory for Social Inclusion, the necessary information is provided for decision-making in planning and social intervention, and research is carried out on the causes and consequences of poverty and social exclusion. Now, we want to go one step further. For this reason, in coordination with UNITAR and other United Nations agencies, and together with the relevant actors, we have launched the Global Initiative on Aging to develop a strategy to address the issue of aging from different perspectives, including human rights, labor, health, education, and science. I am sincerely honored to be part of this launch. It is important that we all work together to highlight the basic opportunity that this challenge presents us as average life expectancy has increased, including the existence of national, regional, and international protection mechanisms, digitalization and improvement of service, intergenerational benefits, public and private innovation in the areas of mobility, healthcare, financial well-being, and participation needed, and participation from the different parties concerned from their respective function. The challenge is not small, but it's important. Thank you very much.